Hi, my name is Angela Wolfe. I am a PharmD candidate from California North State University, and I'll be presenting on the second generation antipsychotic, Seroquel, which also goes by the generic name Quetiapine. Now, Seroquel comes in various different tablet strengths, ranging from 25 milligrams all the way up to 400 milligrams. Moving on to some patient counseling points, we'll go over what the drug is used for, what you should tell your doctor before taking this drug, what are things that you need to know while taking the drug, and some side effects that you should call your doctor about if you experience. Also, how to store the drug, how it's best taken, and what to do if you miss a dose. So Seroquel can be used to treat things such as symptoms of bipolar, schizophrenia, or depression. It can also be given to you for other reasons, which is something you should discuss with your doctor. So some things you should tell your doctor before taking this medication is if you have any allergies to this drug or any allergies to any foods or substances. Also, if you have a history of low potassium or magnesium levels, or if you've ever had or experienced an irregular heartbeat. Some things you should know while taking this drug are to avoid driving or operating any type of vehicle until you see how the medication affects you, especially if you're taking it for the first time. This medication can also cause high blood sugar, high cholesterol, and weight gain. A deadly health problem called NMS, which stands for neuroleptic malignant syndrome, can occur. Also, you want to be careful if you're over the age of 65. Also, a side effect of this medication is you can experience constipation. You also want to let your doctor know if you're pregnant or plan on getting pregnant, or also breastfeeding. Some side effects of Seroquel that you should let your doctor know about right away are any signs of an allergic reaction, signs of low thyroid levels, chest pain or chest pressure, a fast, irregular heartbeat. Also, if you experience shakiness, trouble moving around or stiffness, if you experience severe constipation or severe stomach pain, or also if you experience any signs of a severe muscle problem called tardive dyskinesia. Some other side effects of this medication are dizziness and fatigue, headache, constipation, weight gain, upset stomach, and back pain. So Seroquel comes as a regular release tablet and an extended release tablet. The regular release tablets you can take with or without food, whereas the extended release tablets you want to take on an empty stomach or with a light meal. Also, with these tablets, you want to make sure that you swallow them whole and do not chew, break, or crush them. In regards to storage, you want to make sure you store this medication at room temperature, keep it protected from light, and store it in a dry area. You also want to make sure to keep it in a safe place, out of the reach of children or pets. Now, if you do miss a dose, you want to make sure to take your missed dose as soon as you remember. Now, if it's close to time for your next dose, you want to go ahead and skip that dose that you missed and just go back to your regular routine. So make sure not to take 2 doses at the same time or any extra doses. So some FDA-labeled indications of quetiapine are bipolar disorder and the acute treatment of mania, as well as episodes with mixed features and acute treatment of bipolar major depression. It can also be used to treat major depressive disorder and uses the extended release tablets only as treatment. It's used as an adjunctive therapy in patients who have had an inadequate response to antidepressants for the treatment of major depressive disorder. It can also be used to treat schizophrenia as well. Now, quetiapine can also be used off-label as treatment for other behavior disorders. Now to discuss the interactions and mechanism of action for Seroquel. Some drug-drug interactions for Seroquel include strong CYP3A4 inducers. They can also interact with medications that enhance the anticholinergic effects of Seroquel, such as aclidinium, glycopyrrolate, ilexadoline, and ipratropium. Also, it can increase CNS depressant effects when used with medications such as azelastine and bromoperidol. It can also enhance the adverse effects when taken with medications such as bromopride, amisulpride, or metoclopramide. It can also enhance the QT prolonging effects when used with medications such as posaconazole. In regards to its mechanism of action, it is an antagonist at the neurotransmitter receptors in the brain. It antagonizes the serotonin, dopamine, histamine, and adrenergic receptors. It also has an active metabolite called norquetiapine, which is different from its parent molecule by exhibiting high affinity for muscarinic receptors. For dosing, in bipolar disorder, when used for acute mania, we can use the immediate release tablets, and we can start with 100 to 200 milligrams once daily at bedtime, or we can divide that in 2 doses on the first day. Then we can continue to increase the medication by 100 milligrams per day until we reach 400 milligrams per day by the 4th day. In acute episodes of bipolar disorder with mixed features, we can use the extended release tablets starting with 300 milligrams once daily on the first day, and we can increase to 600 milligrams once daily on the second day. We can then adjust the dose based on the response. In schizophrenia, we can also use the immediate release tablets. We can start with 25 milligrams twice daily and increase in increments of 25 to 50 milligrams per day. We can divide those in 2 to 3 doses on days 2 and 3, and then increase to a target dose of 300 to 400 milligrams per day by the 4th day. We can adjust the dose as needed in increments of 50 to 100 milligrams per day, just no more frequent than every 2 days. In the extended release treatment of schizophrenia, we can start with 300 milligrams once daily, and we can increase in increments of 300 milligrams per day, but no sooner than every day or more. The max dose of quetiapine is 800 milligrams per day for both of these conditions. In terms of dose adjusting, we do not need to dose adjust in renal impairment. We do adjust for hepatic impairment. For the immediate release tablets, we want to dose 25 milligrams once daily, and we can increase that dose by 25 to 50 milligrams per day until we reach the most effective dose. And this is just based on the individual and how they tolerate it and how their body responds to it. With the extended release tablets, we can start with 50 milligrams once daily, and again we can increase the dose by 50 milligrams once daily till we get the desired effective dose. Now, in terms of administration, the immediate release tablets we can administer with or without food. In the extended release tablets, we can also administer without food or with a light meal, something that's less than 300 calories. We want to also administer it preferably in the evening. We want to make sure the patient swallows the tablet whole does not break, crush, or chew the tablet. Some side effects that we see in Seroquel are in regards to cardiovascular, which can include increased blood pressure, orthostatic hypotension, or tachycardia. In regards to the endocrine and metabolic system, we can see decreased HDL, increased serum cholesterol, increased triglycerides, and weight gain. Its effects on the gastrointestinal system include increased appetite or dry mouth. We can also see decreased hemoglobin, as well as agitation, dizziness, drowsiness, any extrapyramidal effects, fatigue, headache, or withdrawal syndrome. Seroquel does have 2 boxed warnings, which include increased mortality in elderly patients with dementia-related psychosis, as well as a warning for suicidal thoughts and behavior in children, adolescents, and young adults. We also want to make sure that we use it with caution in patients with decreased GI motility. Since this is an anticholinergic drug, its effects can exacerbate any underlying conditions. We want to make sure to use this with caution in patients with hepatic disease or impairment. And like I mentioned earlier, we may need to dose adjust. We want to also make sure to use it with caution in patients who are at risk for seizures, and also in patients with urinary retention. And like we talked about those anticholinergic effects, they might exacerbate any underlying condition. And we'll conclude by talking about monitoring parameters. With the Seroquel, we want to make sure that there isn't any clinical worsening, psychosis, suicidality, or any unusual changes in behavior, particularly when we do our first 1 to 2 months of therapy, or if we decide to do any dose adjustments. We also want to monitor their blood pressure, as well as their CBC, electrolytes, and liver function, their glucose and A1C, or any signs or symptoms of neuroleptic malignant syndrome. And what we can see in neuroleptic malignant syndrome are any changes in mental status, fever, or muscle rigidity. And this concludes my presentation on Seroquel. Here are my references.